My husband just passed, so it's kind of I'm still trying to get through losing him in daily life.
An overdose took the life of Victoria St. Arnold's husband. For decades, he had used prescription drugs and opioids to ease the throbbing pain from a series of spine surgeries.
I'm assuming he thought that he had just gotten some normal pills. It turned out that it was actually fentanyl.
100 times more potent than morphine, the synthetic opioid fentanyl has expanded its deadly presence in the United States. Just a couple milligrams of fentanyl, like a few flecks of salt, can kill. But mixed with heroin and methamphetamine, it's a huge profit maker for illegal drug dealers who sell it without the user's knowledge.
Because fentanyl is going to make people more addicted to those drugs, and it's cheaper, it's potent, it's more stronger. We're seeing a lot more drug overdoses as a result.
In the 12 months ending last July, more than 86,000 people had died of an overdose in the United States, officials estimate. That is up 24.2%. And in the nation's capital, a shocking 60% increase in overdose deaths in 2020. Psychiatrist Dr. Nora Volkow says the COVID-19 pandemic has made things worse.
Stress is the strongest predictor about whether people are going to take drugs. And what is stressful? The social isolation that we live on, the loss of jobs, the downturn of the economy. It is easy to fall into behaviors that temporarily make you feel better.
Corri, Cusimano, lost her son to an overdose in 2015. She runs a grief group, Social Distancing Required. She says families can't always afford the medication to reverse an opioid overdose or pay for long-term drug treatment.
Rehab is very expensive. It's anywhere from $6,000 to $14,000 for a 30-day inpatient program. And then after that, they can go into sober living, but they're almost kind of left floundering after that, and there's not that same level of support there.
Now, with the risk of spreading the coronavirus, it's more difficult for people with addiction to get help, especially the poor.
The human factor has been taken out because now people have to use mechanical devices, virtual platforms, in an effort to connect with services. Oftentimes they don't have sufficient internet access and even sometimes the knowledge of how to do that. So it's become very impersonal in a genre that requires human touch and human contact.
In a statement to VOA, the White House says the Biden administration is working on solutions based on science and evidence to expand the addiction workforce and fixing racial disparities in drug policy. Also, drug enforcement agencies are scaling up their prevention campaigns and community outreach.
Starting with school-age children, if they learn early on all the risks associated with these potent lethal substances, that's going to cut off the demand for these substances. It's about prevention, it's about treatment, and it's about enforcement.
It's also about mental health, says Victoria St. Arnold. Families that risk losing a loved one to drugs need to be tough but compassionate and to take care of themselves as well.
Often they really hate themselves because they know how much they're hurting the people around them. I think they need to know that they're loved, but you still have to be firm. You can't just allow certain behaviors because it's harmful to everybody.
Verónica Valderas Iglesias for VOA News, Washington.